Yes, we are officially more than midway through the year, which is just amazing. 2022 seems to be flying by for many of us. I'm so glad you've chosen to join us. I see a lot of people running into our participants here on Zoom. Please do feel free to let us know where you're coming in from. We love hearing from you, and this is going to be just an amazing session today. I also want to take the time while some of you are rolling in to thank those of you who have been showing so much support for the recent TEDx talk, the TEDx Berkeley talk that I shared about in a prior email to the Chi community. So thank you so much for your views and your shares and your comments. They really mean a lot. And I'm learning a lot, right, about TED, about these different platforms, and the constraints that some of them are under. And this is why, honestly, I love what we do here at the Consciousness and Healing Initiative, because we truly have the freedom to explore scientific viewpoints grounded in science as well as in practice that often don't hit the mainstream. And so while we continue to do our work to bring biofield science and biofield healing practices and holistic healing practices to the mainstream, we will continue to do that. We also know that these webinars are a safe space for us to gather, talk, learn from leading lights in the field. And it's truly through your support that we're able to do that. So I want to thank all of you who have signed up as Chi contributors. Those of you who are Chi contributors know that from your generous tax-deductible donation of $108 a year or $9 a month, about the cup of, I guess, a glass of juice a month, you get a lot of juice for this too, right? So you'll be able to access all of the webinars that we've had in perpetuity, conference recordings with many, many leading lights in the field, free resources, so much more. You get curated emails with practices every month to you. And we really do listen to your suggestions and what you'd like to see more of. So we're a community, and community supports one another. So I want to thank you. For those of you who have not joined us as Chi contributors yet, do feel free to do so. Jason will throw in the chat how to do that. And we really want to thank you for your kind support as a 501c3 social profit. Your support means so much. And I am so, so thrilled to introduce our guest for today, who is another servant leader in the field. Her name is Wendie Colter. I have the pleasure of knowing Wendie now for many years, both in research discussions and also from her service, where she serves as part of the Healing Practitioner Council for the Consciousness and Healing Initiative, which meets every month to discuss how we move the needle into bringing these biofield-based practices into healthcare. And she's just been wonderful to work with, very instrumental. And as you'll see, really quite a leader in the field of medical intuition, which we're going to be diving into today. So for those of you who don't know Wendie, I just want to tell you a little bit about her. She's the founder and CEO of The Practical Path, which presents intuitive development programs for wellness professionals. And The Practical Path, the reason she chose that name is because it really reflects her mission to fuse spiritual wisdom traditions with constructive real-world results. She has many certifications as well. She speaks often in different wellness conferences, including the Academy for Integrative Health and Medicine, and more. She's recently just published a book on her work, so we're going to be hearing about that. The name of the book is Essentials of Medical Intuition, A Visionary Path to Wellness. And she's also been involved in helping forward research in medical intuition. So we're going to learn a lot from her today. I'm so excited to have you with us, Wendie. Thank you so much for joining us for the hour.
Oh, thank you, Shamini. It's always a pleasure to see you and to be here and to really be part of promoting Chi and bringing biofield practices into the public awareness.
Yeah, it's so important for our times, right? Because as many of our colleagues say, this is a time that we don't want to forget our inner gifts as we develop our outer technologies, which are wonderful and beautiful, right? We also have these inner technologies that we can develop, and you've been doing this for some time. And I'm just curious, what brought you to the field of medical intuition? How did this begin for you?
Oh gosh, well, then we're going way back. I was always an intuitive child and an intuitive teenager and an intuitive adult. And that kind of intuitive curiosity brought me to energy healing. And I became an energy healing practitioner, a little later in life, but always a fascinating subject. And as I began doing my healing work, or as I was doing my healing work, I noticed that I developed sort of naturally my intuitive abilities to the point where I could see into people's bodies and I could see their life history and I could really get a lot of information. And it sort of went beyond that sort of hit experience into sort of this long, wonderful narrative that the body wanted to tell me and their life history wanted to show me. And their energy really had a lot to express. And I didn't call myself a medical intuitive. I really didn't put that handle on it until I realized that sometimes my clients would heal beautifully using my particular modality, and sometimes they wouldn't, and they would come back again and again with the same issues. And I was very curious, Shamini, as to why people didn't heal, right? That was where my curiosity was. And I wondered if I could take this idea of these hits I would get about certain things in their lives and certain things in their bodies, if I could turn that into a process that would give them a roadmap directly from their biology, their physiology, and their anatomy and their life history, their biofield, if that was possible. And as I began practicing that and working with that, and not doing energy healing along with it, just doing that, I called that a medical intuitive assessment. Eventually, that was the name for it. And I found that information that that I was able to discern for them was so valuable and so useful that, and also was my healing modality even the right one for them? I had to ask their body, is this the right one or is there something else? So that process really brought me to understanding medical intuition, what its purpose is, how it can help someone, and that's where it all began, really. It was just my curiosity to see how to discern more and more. Oh, I think you're muted.
Thank you. Yeah, and I just wanted to make sure you didn't get any background noise and then forgot to unmute there for a moment. I love hearing this because we learn this from so many healing practitioners who've developed their art, right? It is an art. So you're literally working with your patient or your client and you're noticing and you're taking stock, taking inventory of what the body is telling you, what you're getting in terms of information, and then these are how often these systems are developed. And so we have these ancient systems, and then we have the more modern systems as well. um, how does your work compare to, or does it compare at all to indigenous systems of healing? Is medical intuition, has that really been a thing in sort of the more ancient systems? Does it relate in any way?
That's such a good question, Shamini. The answer really is I don't personally know, but I can tell you that medical intuition has been in recorded history for over 200 years, since really the 1800s. Um, uh, is that 200? That's more than 200, isn't it?
And now it is. Yes.
It's a long time. But the point being is that ancient systems recognized energy. Ancient systems recognize the biofield, recognize the energy that it resides within our body and that surrounds our body. So is this an ancient technique? Of course it is. Have medicine healers from ancient times been using their intuition? Of course they have. Have they been able to discern things the way a modern medical intuitive does? Very possibly. I can tell you that the first recorded version of this is from, I'd say, the early 1800s, early to mid 1800s, with the early mesmerists, which is a funny word meaning, Franz Mesmer was a German physician, and he developed this technique, which now we call hypnosis. But at the time, it was a way to kind of use it. Actually, it's early energy healing process.
Yes.
But yeah, what they found was that some scientists and physicians found that when they mesmerized their patient could self-diagnose and also self-recommend remedies. You can imagine the 1800s, what they were giving people for remedies. They could actually come up with remedies in the state that worked and they could do it for other people. And there's a lot of written history about this, lost to time, really. But I was able to find it and wrote about it in the book. And that was all, pretty much decimated by the late 1800s with the mechanistic idea of healthcare and the body, and that we're this mechanical thing. And so all this wonderful as well, of vitalism and mesmerism and prana and chi and everything was kind of replaced in Western society. But that doesn't mean it's not valid and it's not real, and that's what we work with.
It's fascinating, and there's so many places to go with this. I also want to remind folks that we will have time toward the end of the hour for questions. I know that sometimes we have lively conversations. We may not get to questions at the end. I promise you, I'm going to do a better job of making sure that if you have questions that you want answered, that I will make space and time to make sure they're answered. And for those of you joining us on Zoom, the way to do that is at the bottom of your screen, you'll see a little box that says Q&A. So just type your question in there, because if you do it in the chat, we may not see it, but if you put it in Q&A, we will see it, and I will be sure to raise your question for you. So Wendie, with respect to mesmer, this is very interesting. I wrote about this too in my book, because in the context of placebo, because many people don't know that it was efforts to debunk mesmer that actually brought about the placebo-controlled trial, which is very interesting. And you mentioned how people would be put into the state where they would literally be giving their own information, their body's wisdom, right, on what remedies to take. And as a psychologist, I often think about the subconscious, right? The subconscious and the unconscious. Do you feel like that plays a role in your work? How would you describe the process that you're going through to tap into a client's own inner wisdom?
Yeah, you could call it, let's back up a little bit. In Edgar Cayce, who was a very famous US medical intuitive, used to go into a pretty intense trance state, almost a sleeping state, a sleeping trance. And that's one way of doing it. I don't do that. Carolyn Mace, another highly regarded and actually coined the term medical intuitive, also went into sort of a, almost an, I guess you could call it an altered or light trance. I'm not sure she writes about it, but she talks about her process, which is her process. My process is very much in the present moment. It is, a state where we go into a non-local perspective. And that's one of those scientific terms that sometimes people understand and sometimes they don't. It means an expanded awareness. And I think, the medical intuitives of the world would probably agree with this. It's an expanded awareness where we expand our consciousness. We go into a non-local state and we were able to query. And what I do is I have a conversation with someone's body. That's it. And their biofield. It is literally a conversation. Your liver, your kidneys, your lungs, they all have consciousness and they want to communicate. So a medical intuitive, at least the way I practice and train people, is to really have that conversation, begin the conversation and improve it, expand it. We're looking at not only what the physical anatomy is showing us and asking for, but also where life history plays into it, which is, I know, part of your background in psychoneuroimmunology, where the mind and body and spirit and life history influence health.
That's amazing. Just looking at the question, somebody is asking, what are the writings behind you on the right side?
Oh, that's a wonderful, it says knowledge, intuition, and experience combined to guide us in thought and deed. Isn't that nice?
Oh, that's beautiful. Love it. I love it. That's beautiful. So you're tapping into the person's field. And so is this something that you would say anyone can do?
Well, anyone can certainly do it for themselves, without question. We are born intuitive. We never lose that skill. Whether we choose to develop it is a question we can all ask ourselves. Do we want to develop this? But it certainly is something that can be developed. And, I know we talked just a moment before we went on live, is that I was very privileged to offer an audio through Chi as a Chi contributor, where people can actually listen to the audio and practice that mind-body connection and practice having a conversation with your knee or your kidney or whatever, and getting the skill of presence with your body so that we can really pay attention to what our body is asking for.
I love that, and it's a great reminder to us that when we talk about expanding our awareness, a sense of presence and grounding into our bodies is important. So I am curious about your process. So you mentioned the expanded awareness is, as you know, in many of our healing traditions, there are, specific protocols or at least guidance on grounding, centering. Some people do an invocation. There are different things. Is there anything that you do, on a regular basis when you start tuning into another person's field and body? Like, how does
Yeah,
that process work for you?
absolutely. And I was sort of touching on this a little bit earlier when we were talking about the non-local consciousness and how different people do that. What I do is I ground, which is a very deliberate process of connecting my physical body with the earth, right? Energetically speaking. So that's a visualization process. I shield, I make sure that my space is clean and energetically protected, you could say. And then I'm going to connect non-locally with someone's own energy systems. And that's a process I teach. It's a specific process, but um, the process of grounding and shielding our energy is actually something everybody could do. I've written about it in the book. There's exercises on the website, and I recommend people try them because intuitive people can often feel like a sponge, right? Intuitive people talk about, feeling bombarded by everybody's information and, getting a little put off track by that. Well, if you're going to work with energy, it's really important that you know how to work with your own energy and keep your energy clean and balanced and grounded and shielded and all those wonderful things.
That's so key for us to remember, right? Absolutely. So I know that we have been having conversations about research for many years, and we know that research is important to scale these kinds of practices into the healthcare setting, which I know you have a huge passion for. I know that you work with medical professionals, teaching them about this. And I'm just thinking about a conversation I had not too long ago, actually, with my neighbor who is an ER physician who was saying that, he's planning to write a book on the role of intuition in medicine, right? So I think for many
Fantastic.
medical professionals, yeah, this is, they may not think about it the way that we do. They may not talk about the biofield, but they have a felt sense of this being with patients day in and day out. And it's more than just heuristics of, oh, the person is presenting this way and, I've had this history. There is an intuitive process that they're going through. And yet, even if the physicians kind of get this and know it, as you know, in order to get this integrated into the healthcare system and just to understand it better, right? We need to do research. So, and I understand that you've done some research, and I want to preface this by saying, is it true that there's almost no research in medical intuition?
Almost none.
It's shocking, right? It's
It is,
so shocking.
it is shocking, shocking. The research that has been done, most of it was completed over 20 years and past, really through the 90s and somewhat in the 80s and a little bit in the 70s and barely in the 60s. It's like bits and pieces. And there's a reason for that, I think. And as I delved more deeply into the research side, the part of the reason is that medical intuition, like many biofield practices, doesn't fit into the neat little box of, empirical testing because there's so many factors to it. And because the body is so vast and so changeable, really, that it's often not a yes no. It's like, can you do that? Well, yes, you can do randomized control trials with this, of course you can do empirical testing, yes, but the other part of it is what has been the training. Most medical intuitives have been self-taught, just developed it by themselves, which is wonderful, of course. But the reason I started my programs, was because I wanted to teach people a very deliberate method with very predictable results. We could repeat this, we could count on it. And I was very pleased to see that my students were, getting great case. They have to do a lot of practicum hours. So there's case reports, there's all of that. And when I realized that there was hardly research on it, and most of it inconclusive. I thought, we got to have something here. So I put together a study with some colleagues whom you know very well, Dr. Paul Mills and some folks down in San Diego at UCSD. And what we did was created a survey, an exploratory study, basically, using some of my students who were trained in a very specific method, and 67 participants from the community. And some of those folks were people from UCSD medical patients who wanted to play with us. And the outcome of the survey was great. So these were blinded sessions. Now it was exploratory, and it was, kind of the way we could do it. So we did it as blinded as we could. So we had no access to their medical history. We don't do an intake anyway. And the medical intuitives keep their eyes closed, and they did the sessions. And we came out with very phenomenal numbers. We had 94% accuracy in the medical intuitives location and evaluation of the participants' primary health concern. And that number, is pretty phenomenal. We had 98% accuracy in the medical intuitives description of life history that could relate to the person's health issue. There was recognition there. And, of course, we don't know anything about someone's life history. We're just looking to see what's there to look at. We also had 94% consistency in participants' known medical diagnosis. In other words, we're describing what we see. We asked, in the survey, we asked the participants, do you have a known medical diagnosis? We didn't ask that in the session. And if they said yes, we asked how consistent was the medical intuitive with your diagnosis, and 94% consistent, which was fabulous to see. And there was a bunch of other questions as well. And all of that is in the book and on the website. All of this data was like, well, okay, what do we do with this? Well, we got it published in the Journal of Alternative and Complementary Medicine, which is a peer-reviewed medical journal. And it represents the first research in over 20 years, about 20 years, on this skill set. So for that, hooray, that's very exciting. And we're doing more. We just partnered with Institute of Noetic Sciences to do another research study where we bring the doctors in with the medical intuitives and the patients, and we're going to see if we can see what value that can bring.
Well, that's exciting. Great developments there in the field. Yeah.
Yeah. And a long time coming.
A long time coming. Yeah, indeed. Indeed. So that brings a question up for me, which is, often in medicine, we work by pathology, right? And, in psychology, for example, we'll use the DSM to diagnose a particular pathology. But often when I speak with healers from different traditions, both modern and ancient, that's not how they approach the body, right? Because they're looking at disharmonies, not necessarily diseases that are categorized in a particular way from a particular book. And so this is often like when you see in Chinese medicine, for example, different so-called subtypes of things like rheumatoid arthritis or whatever, right? It's not so much about the diagnosis of arthritis as it is about the disharmony and the way it's showing up, elementally speaking or constitutionally speaking. How does that work for you all? I mean, you're talking about the study, right, where you had accuracy on a diagnosis. So when you all are doing your work, are you really kind of focusing in on asking the person intuitively or their field, what kind of diagnosis do you have? Or are you actually seeing the body? Are you feeling the body? Like, what is happening?
So I'll answer all of those questions. First of all, medical intuitives do not diagnose unless they are licensed healthcare professionals that can legally, under their scope of practice, diagnose. And I teach MDs, doctors and nurse practitioners and Chinese medicine folks who have under their purview the ability to do that. As a medical intuitive who does not have that background, and this is how I train people anyway, we don't diagnose. What we do is we explain what we see. And yes, we look at the anatomy, the physical body anatomy, and the physiology, how it's working. That is very specific, and I think maybe even unique to medical intuition. And that's why it is called medical intuition, because we're looking at the physical body. We're not only looking at energy patterns. Energy patterns within the biofield are really important to look at as well. So we're looking at the chakra system and the auric field and the life history, but all of that together, including the nuts and bolts of the physical body, the anatomy, and how things are working or not working. This is really important because medical intuitives traditionally see connections that medical science doesn't make, right?
Mm.
Happens constantly. There's If you look in the case studies in the book outline this, and just from my perspective, 20 years ago when I started this, I was seeing bacterial overgrowth in the small intestine, and something that looked like a mold infestation, and things that would now be called chronic fatigue and all that stuff. That at the time, the medical community had no words. They didn't have a name for it, right? They didn't even know the symptomology of it. But
Mm.
as a medical intuitive, and many medical intuitives, we see all of these things, and we're making connections that medical science doesn't make. And that's where it gets really, really exciting, because that is cutting edge healthcare, right? Okay, this is connected to that. Well, when medical science comes around to it and goes, oh yes, we see a connection here, because that's like, yeah, well, we've been seeing this for 20, 30 years,
Right,
So
right.
that's where I see medical intuition can really be of incredible value to healthcare, because it's going to expand the understanding of how the body functions. Not just the body, but how the energy influences, our biofield is influencing how our thoughts, how our life history. Shaman, I have to share with you, when the studies on ACEs came out, whenever it was, 15 years ago or something, 10, something like that, when it started getting into the magazines and stuff and people were reading about it, I just had to laugh. I'm like, well, as a medical intuitive, been seeing that for decades, hundreds of years.
And just to clarify for anyone who doesn't know, the ACEs study is adverse childhood events, right? So a very large study that was done looking at the health implications for those who have suffered from significant adversity early in childhood. And so what you're saying is you're like, well, duh, right? Because I see this all the time.
Kind of a big well duh. Yeah, exactly. And intuitives have seen this of all kinds for centuries, and it's fascinating to get the science to corroborate what the intuitives have been working with. That's
Well,
where
let's talk
I
about
love
that
that.
for a moment because, as we know, trauma has definitely hit full stage in the last few years, and there's an openness now to talk about trauma and the relationships of trauma with health in a way that we have never seen before. And yes, I agree with you. Long time coming, long time coming. I mean, we've had leaders in psychoneuroimmunology, who have been pointing these things out for some time, and now it's definitely entered the general public's mind. From
Yeah.
your perspective, with the work that you have been doing for so many years in medical intuition, would you say that early life trauma begets disharmony, disease in multiple expressions in the body? In other words, are many of the sort of instigating insults to the body related to a traumatic experience? I mean, some people feel that way and some people don't. So I'm just really curious what your take is.
What I've seen is, and I'll start by giving you my idea of what the principle of medical intuition is. The principle is that the body stores or holds information that relates not only to physical imbalances, but also emotional, mental, and spiritual imbalances. That is the premise by which I work and teach. And that means that, and trauma is a really big word. It's a big word. And the way it's been talked about in psychological circles, and I think in psychoneuroimmunology perhaps, is that, the big traumas, the abuse, the alcoholism, the drug addiction, all that horrible, difficult, painful early life experience can their correlations are clear now that it can lead to all kinds of health issues. Well, what about what I call subtle trauma? Subtle trauma. That also can create imbalances in the energy field. It can create health issues later that might be mysterious, like where did that come from? That's what I look for. And along with the big stuff, it's whatever the body's hanging on to or holding on to. And that combination of emotional and physical and mental and spiritual can cause all kinds of imbalance later in life, not just physical, but in every way. That's fascinating to look at, Shamini, because it's not really well recognized in healthcare right now, certainly not in psychology. And I wrote about this in the book, and I call it subtle trauma, subtle energetic damage, meaning, here's an example, and it's not a great one, but it's an example. If a child breaks a toy, they're a toddler and they break a toy, right? Kids do this all the time, or they write on the wall with crayons or something, right? And mother comes along and scolds, bad child. And, there's an emotional event there. Well, that's not to, castigate mothers or anybody who needs to discipline a child. But what can happen is if it's not resolved in some way, in a healthy emotional way, that can stay in the energy field, and it can cause all kinds of things going forward. Maybe not physical, but what about the way the child looks at the world, the way the child thinks about themselves, how decisions, unconscious, subconscious, whatever, these things happen. And medical intuition, the way I work it and use it, is that these things are significant and they can fuel imbalances in all areas.
Mm. Love it. It's definitely a very whole systems, whole person approach, right? And
Yeah.
obviously very consistent with what we were learning in psychoneuroimmunology about at least, significant adverse events. And here we're talking about, poverty, the witnessing and experiencing of violence, and how it will actually change the set points epigenetically for us to express different kinds of proteins that cause inflammation in the body. And then we would think of, what are those propensities that we're carrying from our lineage, which is spiritual as well as physical, right?
Mm-hmm.
That might allow that inflammation to be expressed in heart disease, gastrointestinal disorders, and other things.
Yeah, epigenetics is fascinating. And, there are people who would posit, and I would too, what about past life? What about energetic influences that come down that line, different line, but it's still valid. And, of course, science goes bonkers with that one. But what I'm saying here is that medical intuition can look at things in an even more subtle way that are just as impactful and significant. And I think we're on the cusp of, as these fields develop, I think this is going to be the next step, is looking at how these things work on not just the obvious, violence and all that, but what about these little subtle traumas that happen all throughout our life? How does that work? How does that influence? Because we see it.
Hmm. Yeah, yeah. Microaggressions, as some people like to call them, right? Micro perturbations in the biofield. So I
Sure.
know that your approach doesn't necessarily focus on treatment, but I'm curious. Say I went to you and I said, Wendie, I want you to just sort of figure out what's going on with me. And you figure something out. What are you most likely to tell me in terms of what I would do? Say,
I
oh, I see this disharmony, this is going on. What would you do next?
I love that question. I really do, because it's one I don't get to talk about quite enough. And that is that the body recommends what it wants. It'll tell me, it'll show me really what it is your body is asking for. And what that means is I'm not coming to this with any body of knowledge bias, right? And this is what healthcare does all the time, because it has to. It has to. People get their education. They study to be a naturopathic doctor, a Chinese medicine doctor, a conventional medicine physician, whatever it is they're studying. They have to look through that lens of that education, right? Because that's what people are coming to them for. Well, medical intuition is the obliteration of it. We can't have a lens. If we have a lens, what are we doing? We're narrowing our vision. So what I need to do is just have a pure conversation, really, with your whatever's going on, with your knee or your liver or whatever, and say, okay, your lower back, whatever it is, what is it that you want? Body part, body area, cells, what is it that you want? And that's what I would impart to you. And it has nothing to do with my body of knowledge. And, whatever I've done or studied has nothing to do with anything, but purely what your body and your energy field wants me to know so that you have that information. And that is why it is not a healing process, but the process of hearing, what the body wants creates, and I mentioned this earlier, a roadmap, a path, so that my client can take this information to their doctors, can go out and seek different kinds of treatment or care that they might not have even considered that their body's asking for, and find a way forward. And what's so valuable about this is that the clients that medical intuitives typically get are the people that have been through the mill of conventional medicine or who have tried half a dozen alternative modalities and nothing has worked, right?
I'm going to ask you, what kinds of folks do you normally see? Who comes to you? Yeah.
Typically, that is what medical intuitives, that's the kind of folks that medical intuitives have seen for decades, centuries maybe, because what are they going to do? And, for someone to hear from their doctor, there's nothing more they can do for them. That is the most that's really devastating thing to hear. And it's actually not true. There's always something that someone can adjust or work towards, or, I don't even know the right words for it, but shift in their own energy in regards to whatever's going on. Somehow there's a way, there's something, there's information there, put it that way.
Yeah, amazing. Amazing. And it brings up a question around, when would be the appropriate time to use medical intuition? I know you have a lot of passion for integrating this into healthcare, right? And many of us in the holistic health field and research field say, well, we kind of have this backwards because there has been this cultural idea that you go to the so-called alternative practitioners when you have no hope, when things are so bad, when nobody has any answers, when you're on death's door, right? Then go see the alternative practitioner, right? But there could be another way that this could be used. And so I'm curious, when you're doing this kind of process, I don't know how often you see people, for example, like, do you see them over time? Do you have a sense that if I see you earlier, I could potentially detect a disharmony before it instantiates into a disease? We talk about building technology to do this, right? It's a very popular topic in our field, as you know. When are
Yep,
we going to
yep.
build that biofield machine that's going to detect disease before it manifests into the physical body?
Yeah.
So can medical intuition do this?
Without question, we see things that have not yet manifested that are in the energetic phase and energetic stage. That is really common and very much a cornerstone of medical intuition. What that does is it gives the client the opportunity to take action before something manifests. I mean, seriously, how awesome is that? So, machines notwithstanding, medical intuition does exactly the same thing in that, I can't really give examples here because I don't want to overstep someone's confidentiality, but this happens constantly. I'm seeing things that happen. Well, here's a good example from the book. That where I saw something that actually isn't even yet in medical science, not exactly what you're talking about, but it's the same concept. It was a gentleman who was interested he had a hernia issue, and he was wondering if he should get a surgery for, mesh. And he was really worried about the mesh because there's a lot of mesh rejection and all this. This was some time ago. And as I was looking at his body and asking his, kind of gut area, could the mesh hold and whatever, I saw this image of a piece of mesh coated in stem cells. Right. And it was showing me, and this was his energy field because he was interested in this. And I was tapping into this non-local consciousness that we do as medical intuitives. And it was showing me that if he could talk to a surgeon about coating the mesh with his stem cells, it wouldn't reject. That's what his body was saying. It wouldn't reject if he did this. And I'm like, I've never even heard of this. And when I asked further about it in the quantum field, you could say, I saw that there was a study that had just been completed in a foreign country about this. And this was, I think it was 2018 or 17, something like that, where it hadn't actually it wasn't actually part of anything that a surgeon would offer at this point in time. Well, he's like, well, that's interesting. I've never heard of that. I'm like, I don't know. Got off when we ended the session, I got on Google and I found a study that had just been completed the month before in
Oh my.
China on stem cells on mesh to prevent rejection and inflammation. I mean, there it was, exactly what I was tuning into. This is not uncommon for medical intuitives to see this kind of thing, that, okay, there's going to be a process here that you could talk to your doctor. I said, to go talk to your doctor, tell him to go find the study.
Wow. Yeah,
And
amazing.
a few years later, here it is. It was approved and now people are using it. Again, this is how medical intuition works. And you can say, from a broader perspective, I use the word non-local. That's a great way to say it. So not only am I tapping into your physical body, your physiology, your life history, that's certainly non-local to do that, meaning it's not, in the here and now, it's in some expanded space. We can tap into whatever is out there. I was seeing SIBO before there was a word for SIBO, small intestinal bacterial overgrowth. I was seeing chronic fatigue. I was seeing things that medical science did not have a name for at the time. So this is about the ability to tap into intuitively what can assist healthcare, what can assist healing. And that's a million reasons why it should be integrated into healthcare, why we need medical intuitives in every hospital, why we need physicians and healers to become medical intuitives. It's a foundational support system, skill set, I should say, that supports any kind of healthcare, whether you're an energy healer or you're a surgeon, anything. And that's how I see it. So it's not like another modality. It's really a foundational
Mhm.
perspective.
It really challenges us, right? I mean, in the last webinar we had with Lissa Rankin, we talked about integrating the masculine and feminine approaches to medicine, right? And
Yeah.
we talked a bit about how we're typically trained in the sciences, in the healthcare system. We learn about diagnoses, we learn how to put things in boxes, we learn how to be reliable and sensitive in our diagnoses, what kinds of treatments are evidence-based, right? It's a very for lack of a better term, masculinized approach, in that we're being very, very specific. We're being very, very targeted. We're being very, very precise. And there's a beauty to that. And there's also this whole other side of our being, right, which is intuitive by nature, that gets information in a different way, so that we're not going, as you say, with a lens that's creating a tunnel vision when we begin. So reconciling those two aspects of our being are pretty difficult for most of us, right? But certainly in the healthcare field, it's a real issue right now, as it's a real issue. It's like, what, placebo is meaningful? Like, what, all of these effects are actually more powerful together than just the targeted drug, right? It blows most people's minds. So you have been doing this work with doctors, and I just want to thank you. We are getting to questions. We have a lot of questions. I promise we're getting to them right after this. Um, you've been doing this work with doctors and all that.
Yeah.
What's their process like? They're coming in and they're like, they've been trained a certain way, right? You're opening them up to kind of, and they're obviously coming to you because they have a yearning to do this, right? Or they wouldn't be coming to you. It's not like they're being forced to come to you and learn this.
You're talking about the students that are medical
Yeah, the
doctors, my
students,
students?
like
Oh, they're
especially
the best.
the
They're
medicals, the doctors, like how does this work for them?
Well, it's a learning curve. It's a learning curve because that left brain, so to speak, analytical mind, doesn't serve in this environment. Now, having that body of knowledge and that, let me just back up for a minute and say, I knew that I wanted to teach people in healthcare, and I knew that people in healthcare had that, that you have to have a method, you have to have a step-by-step process, and it has to make sense to that left brain. Otherwise, whatever, what are we doing? So the process, the method that I created is really designed for left brain people to learn how to develop that, I hate to say left and right brain because it doesn't even matter, but that intuitive, more creative sense that informs the diagnostic process, right? So when I work with doctors, I'll never forget the first doctors I worked with. They heard about me And their patients were saying, oh, I talked to this lady. So they'd call me and go like very under the radar and surreptitiously, I've got this patient that I can't figure out what's going on with them. And I'd look and I'd say, well, is this, and this, and I see that connection and that connection. They go, oh, thank you. And they'd run off and do their thing. And that's a great way that medical intuitives have worked with physicians for decades. That's one way. Teaching the doctors is that learning curve of them learning to trust. Everybody's learning curve, learning to trust that the information that they're receiving intuitively is valid and correct. And that's where the hangup is. It's not that they're not receiving valid and correct information, because they are. It's the trusting process. And that's what, let me just say it, Shamini, it's what mechanized medicine has wrought over the years, is this lack of trust in one's own intuitive gut feelings, hunches, senses, whatever you want to call it. That's awful. I look back at the last, piece of time, like, oh, why did we do that? Well, there's something valid in that. Yes, we want the scientific process. We want that method. We want to validate things. Nothing wrong with that. But there's all kinds of validation, isn't there? Right? Mm-hmm. There's the validation of somebody saying, wow, that made so much sense. My whole perspective is shifted, and I'm going to go off and do this now. And I'm going to, things change, they shift. Well, what about that? Is that not valid? Mm-hmm. As along with saying, I see a something that looks like a, inflammation here. And then, yes, it's corroborated. That's wonderful. Mm-hmm. But what about the rest of it?
Yeah. Well, thank you for all of this. And I'm going to make good on my promise, y'all, right now. I'm bringing up the questions because I know we have a lot of. So, okay. So there's more of a personal question about, do you see new people? Is it a distant? Da, da, da. I would suspect
it's all remote.
Website. Yeah. Okay.
Yeah. So. And actually, let me just say to the audience here, the sessions are remote. We can do them on Zoom, on phone. The training is all remote. So we meet in Zoom. It's a live classroom in Zoom. Yeah.
Great. And here's a great question from Kathleen. Even though you always tell your client to work with their physician, do you worry about your client deciding that you are the final word and not seeking medical care?
Yes, and actually in my program, I train all of the medical intuitives that we cannot be the last word. It's a false notion. I'll tell you why. We're all in charge of our own healthcare. And what we're doing is we're making suggestions, and based on what we see in the body, we're not giving anybody the last word on anything. We all have free will. Please hear that. We need to make decisions that align with our own understanding and our own sense of intuition. So what medical intuitives ideally can do is just open that door a little wider, right? Here's some more information for you to work with.
Beautiful. Okay, we have a few questions now about what your process is of grounding and connecting, and there is the request for a demo of that. I don't know how easy that is to do. I just want to remind people that on the Chi Contributor portal, Wendie has given us an audio, you could call it meditation or guidance on this process, correct?
Yes, it's called Your Body's Wisdom. And it is a process. It's actually it's the guided meditation that will show you how to open the mind-body communication between your own conscious awareness, your intuition, and your physical body. And I recommend you go take a listen to it. It's a lot of fun, and you can practice the same kind of skill that a medical intuitive would use when they observe your body.
That's great. And that's on the Chi Contributor portal. So all the Chi contributors have full access to that. As well as many, many other things. Ellen is also asking, you use grounding techniques prior to a session. Do you also cleanse yourself after a session? What happens after?
Oh, yes. In order to practice this process, we need to have some I call them energy hygiene skills. We talk about washing your hands. Well, what about cleaning your energy, right? Grounding, shielding, which is a way of keeping your energy I would say protected or shielded. There's techniques to balance your own energy. There's all kinds of techniques that I teach for practitioners and actually also for the public, because everybody needs, in my opinion, needs to know this, should learn how to balance their own energy, especially if you are highly sensitive or highly intuitive and you feel like you're soaking up other people's information or you feel bombarded by it. You really do want to try to practice these techniques.
Hmm. Beautiful. A question about how would one go about finding a real medical intuitive, and is this something that can be done at a distance?
Yes, it absolutely can be done at a distance. It is 100% a remote skill, although there are people who still want to see people in person, and you might enjoy that. That's perfectly fine. Um, how might one might go around about finding someone is a really good question. So I'm going to answer that two ways. Number one, on my website, thepracticalpath.com, there's a listing of some, not all, of our certified practitioners, and you're welcome to have a session with me or with any one of them. They've been trained in my method. The other part of that question is the National Organization for Medical Intuition has just launched at the end of last month. And that is an organization put together by myself and some of the other very experienced and leading lights in medical intuition in the field. And our purpose in putting this organization together is to educate the public and educate healthcare providers on medical intuition. So you can find that at NOMI, N-O-M-I, medicalintuition.org, NOMI, medicalintuition.org. And we've just launched it. We're going to open it up to memberships for professional medical intuitives and for the public. So we're just getting started with that. Go and check that one out.
That's beautiful. Wonderful. There's some other really, really great questions here. Two of these questions are somewhat related. Okay. We'll start with one that is a simple question to begin with. A simple, maybe in the question, perhaps not in the answer, which is from Sally, who asks, can you see the thoughts that create disease?
Yes, absolutely, 100%. The
So,
thoughts, the beliefs, the life history. So mental, emotional, spiritual, physical, that's the areas that we work in. So absolutely 100%. And that's a huge part of it. Everybody out there, Bruce Lipton, you, Shamini, we all talk about these inherent belief systems or beliefs that sort of permeate, and they can cause a lot of problems. So
yeah.
yeah.
So that kind of relates to another question that Shane has, which is, does your approach have a map or model of the biofield that helps you guide your clients or the insights to look at what needs to be released, healed, or transformed in the biofield? Or is it purely intuitive on the part of the client and therapist and unique to each client?
Well, there is a model that I use that I've created and developed. And we are looking, when we talk about specifically the biofield, not the physical anatomy, what we're looking at is the chakra system and the auric field. That's what I train people in. And that's the 7 major chakras. There are many more than that. And the 7 layers of the aura. And there are many more than those. But it gives my practitioners the opportunity to look into each of these biofield pieces, you could say, and delve into them. Yes, 100%. And we want to do that. Second half of the question was, remind me.
Second half of the question was, is this more of a purely intuitive approach that doesn't have a model per se that's unique to each client?
So the technique that I have developed and teach is a specific method. The uniqueness is unique to each client. In other words, your 4th chakra and somebody else's 4th chakra are going to look completely different, right? Because it's whatever your life history, whatever your energy is about it. So what I don't teach is this equals that, right? That's a different kind, that's a bias approach. If I say every chakra has to be this color and have this information in it, what will I miss? Well, everything that's not that.
Yeah,
So that's
absolutely.
that lack of bias perspective. So it is unique, but it is not unique in terms of not having a method. The method is itself quite specific.
Got perfect. Thank you for that clarity. Lovely. So some really great questions here about access. Ellen writes, how would underserved low-income patients access medical intuitive services? And following that, right after Ellen, Molly asks the question, it seems that a very real barrier is who will pay for it. best practice is evidence-based and treatments are assigned cost codes. So what is your vision here, Wendie? Because I know you have one.
I just love this. Yes, medical intuitives, there's no like, set price for them. They charge whatever, they feel their experience and ability to serve is. Certainly it is not yet, you heard the word yet, covered by insurance. As biofield practices become more into the mainstream, and both you and I, Shamini, we see this as the future here. We can hope that insurance coding will come. That's one of the things that NOMI, the national organization, is looking at. Can we develop service codes for insurance for medical intuition? Why not? Can we integrate it in such a way that the underserved can access it? Because access is hugely important. Sliding scales, I know many medical intuitives use sliding scales. We are also looking at bringing medical intuitives into clinics on a trial basis. That's one of our goals, is to just bring this into the community and see how it can be used. The study that we're doing with IONS has to do with working directly with doctors. I mean, really, the future is kind of open for this.
Yes, beautiful. And it's really important that one of the questions related to this was, essentially, um, how do we address things like bullying and racism? And, how does that show up in the work that you're doing? And we talked a bit about trauma, right, earlier.
That's where it shows up.
So we need
Um,
to, yeah, be able to address that appropriately in communities.
oh,
And
without question.
and I just want to send this out to folks that might have been new to us when the murder of George Floyd happened, we actually created a joint letter on this very issue of systemic racism and trauma. And so I'm actually putting that into the chat right now for anyone who wants to look at this. This was a joint letter, co-created and signed by many, many leaders in the holistic health and energy healing field. That gives a lot of information. It is something that we are very, very deeply concerned about, aware of, and consider to be really, really important in the healing field. So there are many people, Wendie, I know you included, that are passionate about figuring out how do we bring these services, not just, there's a joke sometimes, right, about how do we bring the biofield out of the ghetto, but the real question for me is how do we bring biofield out of the spa, right? Because
Oh,
it's not.
yeah, sure. Yeah, and it's not just medical intuition. It's pretty much any look, this is all because of, well, I don't want to get on too big a soapbox that's different than where we are, but our medical system certainly is in need of an overhaul. And you and others are, and myself too, are really working hard to legitimize biofield practices in order to have them be available to everyone. That's the goal. Not just to legitimize them in the eyes of the medical community. The people already that use them already know the value. So can we work this in such a way that it's more accessible? I appreciate that.
Yeah, absolutely. I mean, that is the key to the work, is that it is accessible to all, especially the groups that need it the most, who may not have access through the medical system. And there are lots of conversations being held about what are the best ways to do that, right? To get the evidence base out for people, but also get the practices out for people. It's really key. And as you know, Wendie, we, in the Consciousness and Healing Initiative, we're surrounded by so many amazing leaders, including yourself, that are working hard in our council meetings to address these very questions.
Yeah.
So it's definitely something that the field is focused on.
Yeah, it's a huge part of the conversation. It needs to continue.
Yeah. And with that, I want to thank everyone for joining us. I hope we got most of your questions answered. Maybe Wendie will come back another time. You can certainly check her out. I think Jason's been popping her links in the chat. And Wendie, anything that you would want to share with folks before we part ways?
Yes, absolutely. Thank you so much for having me. First of all, it's always a pleasure to have these great in-depth conversations, and the audience for Chi is just phenomenal. And we're really building a just important community. I want to just let people know that the programs are available. I teach twice a year. They are for wellness professionals of all kinds, from health coaches, massage therapists to, all the way to medical doctors and whatever. It's a wonderful group. I also have a workshop for the public to learn how to gain these tools for themselves. And that workshop is called Medical Intuition for Healing. Please join our newsletter, and there will be a self-study program on that coming out later this year, early next year. And there's all kinds of resources on the website. Please take a look. There's guided meditations, and check out the book. And that's what I have for resources for folks.
Lots of resources and getting a lot of comments. Wow, this hour just flew by. Thank you very much. Much appreciation from everyone and appreciation from me and of course the entire Chi team, Wendie, for taking the time and sharing your wisdom with us today, your heart and your vision to bring forth this type of gift that we all can cultivate, right? For our
Thank
own.
you.
Yeah.
Yeah,
Thank you.
thank you, Shamini, for providing the forum for this, and for Chi, and for all the work you're doing. It's just blazing a trail to the future. We're very grateful.
Thank you. Thank you, everybody. See y'all soon.